The gastric bypass is still, even today in 2018, considered the gold standard for weight loss surgery. And what that involves is making a small stomach pouch and then rerouting the intestines up to that pouch. And it does two major things. One, you feel full much faster, so you eat less. And the other thing that happens is that you don't absorb all the calories that you just put in because of the bypass of the intestine. So that's a good thing. A lot of people worry about nutrition and supplements, and I always tell them not to worry about that. That's completely preventable if you take your supplements after surgery. The main thing though is that it's a little bit of a forgiveness, because if you do make a mistake, we're all human and you will, you're not going to absorb every single calorie you put in. We think that is why this procedure works so much better than procedures that don't involve any malabsorption, is that you're not absorbing every calorie. And that's the best way to look at it. The other way to look at the gastric bypass is the fact we're not actually taking any body parts out. We're not permanently removing a stomach. It is technically reversible. So even though the picture may look confusing, it is still a reversible operation. Very, very safe operation. The leak rate is somewhere in our practice, in our hands, less than, 1%, far less than 1%. And most patients go home the next day, the next morning, so about 24-hour hospital stay. And most patients are back to work in about a week. The wound complication rates are really, really low, less than 0.1%. So it has all the advantages of feeling full faster, not absorbing all the calories you're going to eat. The weight loss is somewhere between 60 to 80% of your excess weight. So again, if you're 100 pounds overweight, you're looking at 60 to 80 pounds during that year. It's fast. Most of the weight's dropped in the first 6 months. Why is that important? Because let's say you do have hip, knee, and back pain. You got to get some weight off so you can start exercising. It's hard to do that when your hip and knees and back hurt from the excess weight. So just the significant amount of weight loss is a really, really good thing, and it helps people become more active. So we really do like the gastric bypass.